Hello students, I am Əliyeva A, Associate Professor of the Pathophysiology Department. The topic of our lecture is Introduction into the Pathophysiology. Today we will talk about the subject of pathophysiology and its main concepts. The plan of lecture, we will talk about the subject and the main methods of pathophysiology, and then the problems of the nosology, about the general nosology and identification of the norm, health, diseases, the states of the life of the body, then the mechanisms of the sanogenesis, theories of diseases, then the general etiology, the main problems of the general pathogenesis, and at last the main principles of the treatment of diseases. Pathological physiology is a science that studies cause, mechanisms, onset, and outcome of diseases. It also includes knowledge about the reactivity, resistance of organism, the morbid state, and the essence of diseases. The main task of pathophysiology also includes principles of the diagnosis, the treatment, and elaboration of the preventive measures of diseases. Pathophysiology consists of two parts, two sections. The first is general pathophysiology, and the second is specific pathophysiology. That means pathophysiology of the organs and systems. The general pathophysiology, this part combines two sections, two parts, general nosology and typical pathological processes. General nosology studies the essence of diseases, the etiology, pathogenesis, the role of heredity, the reactivity of the organism in the onset of the pathological processes, as well as environmental factors leading to the development of diseases. In the second section, called typical pathological processes. Typical pathological processes have been formed in the process of evolution, as they are the complex of the pathological and protected defense reactions. Typical pathological processes include cell injury, inflammation, fever, allergy, the local disorders of the local circulation, tumor, typical metabolic disorders, edema, hypoxia, and etc. And all of them we will study in the first semester. Specific pathophysiology studies the pathophysiological changes that occur in each organ and systems. In this section, the general pattern of the development of pathological processes, pathological condition in individual functional systems are widely studied. Now about the method of the pathophysiology. Pathophysiology is based on an experimental method. The main method of pathophysiology, that's the specific method of the pathophysiology, is biological modeling of diseases. Biological modeling means diseases are reproduced on the laboratory animals. We use rabbits, frogs, rats, mice, and other animals for the pathophysiological experiments. And experiments are divided in acute and chronic. The acute and chronic experiments resemble the acute and chronic diseases. The pathological processes such as shock, the acute bleeding, for example, asphyxia, poisoning are studied usually in acute experiments. And chronic modeling makes it possible to study the diseases in detail. The experimental model of the diabetes, myocardial infarction, atherosclerosis, arterial hypertension are reproduced in the chronic experiments. The vast number of acute and chronic experiments are applied in pathophysiological research. For example, innervation, the dissection of the nerve which innervate the tissue, then transplantation, stimulation, damaging, removing of the organs, for example, the removing of adrenal glands, which called adrenalectomy, or the removing of kidney, nephrectomy. The other methods are the blocking of the normal pattern of the vital functions of organs, all they used in the pathophysiological experiments. And the clinical methods are applied in pathophysiology too. The clinical pathophysiology investigates the disturbances of the physiological processes in the pathophysiological process in the diseased person, in the patients. And the mathematical modeling of the diseases are also applied in pathophysiology. and at last all results obtained from the experiments should be subjected to the theoretical analysis. General nosology. General nosology, it's the first section of the pathophysiology, and general nosology studies the general laws of origin, general etiology, the development, general pathogenesis, the outcome, as well as the structure of diseases, and also the hereditary and the reactivity in the development of diseases is the main problem of this section. The main task of nosology to define the main terms of pathology, to identify the norm, health, disease, pathological reaction, pathological process, pathological state, to differentiate them from each other. Health, norm, and diseases. Health and disease are two basic forms, periods of our life. And to understand the essence of disease, it's important to determine what is a normal, healthy life beyond which the disease occurs. The norm is considered an indicator that is optimal for the individual in specific conditions. The norm is a parameter that varies within optimal limits. There are different forms of norm: average norm, adaptive norm, dynamic norm, correlation of norm. And each individual, depending on the genetic, age, gender, environmental, geographical point of view, has average statistical standards. And indices that are most often found in the population is called average statistical norm. The adaptive norm is a fluctuation of the physiological and biochemical parameters of the body within the norm occurring under the influence of environmental factors. For example, an increase in the number of red blood cells in the people that live in the mountains, in the highlands. The dynamic norm is the individual fluctuation of the average statistical indices. And the correlation of the norm is a set of the average, adaptive, and dynamic norms. And you see here the definition of health is given by WHO, the World Health Organization. Health is a state of complete physical, psychical, and social well-being, and not just the absence of the disease and physical defects. Diseases. It's a main task of nosology to differentiate the diseases from the pathological reaction, pathological process, any pathological state of the organism. And disease is a disruption of the normal functioning of the organism that occurs due to genetic defect or under influence of pathogenic factors. Health and disease are various qualitative forms of interaction between the body and the environment. Unlike health, disease is the adaptation of the damaged organism to conditions of the existence. The adaptation of the damaged organism to the environment goes in a different level between the protective, adaptive, and compensatory mechanisms that were formed in the process of evolution and genetically encoded, and the mismatch arises in the specific situation. If the recovery mechanisms that are the sonogenic mechanism cannot restore the impaired homeostasis of the damaged organism, the disease is set in. If the recovery mechanism cannot turn off, then the damage of the body cannot adapt to the living conditions and ceases to exist. From this point of view, the definition of the disease given by Ado is more important. Ado is a Russian scientist, and in his definition, disease is a life of the damaged organism with the participation of the process of compensation of its impaired function. Disease reduces working capacity of the organism. Another task of nosology, general nosology, to identify pathological process, pathological reaction, pathological state, and typical pathological processes from each other. A pathological process is a complex of damaging and restoration processes that occur in a regular consequence as a result of the action of the pathogenic factor at various structural levels of the body. For example, at the level of the submolecular, the molecular level, cellular, tissue, organ, and the systemic level in a whole organism. There are a number of differences between pathological process and diseases. Pathological reaction is an inadequate short-term response of the body to ordinary and extraordinary stimuli, for example, allergic reactions. Pathological state is a set of long-term, slowly developing pathological changes that have arisen as a result of the pathological process. In most cases, the cause of the development of pathological states is transferred from the pathological process and diseases. For example, scar, stump after amputation of the limbs, the lameness, bluntness, bone deformation, as well as genetic defects and intrauterine malformations. For example, brachydactylia, syndactylia, the polydactylia, and incomplete closure of the spinal canal, spina bifida, and etc. And at last, typical pathological processes. They are the evolutionary formed mechanisms that are protective and adaptive in nature. Typical pathological processes are stereotypical, they are universal, polyetiologic, and monopathogenetic in nature. These processes, typical pathological processes, include cell injury, inflammation, fever, edema, dystrophy, tumors, extreme conditions, extreme states, and hypoxia. The stages of diseases are the following. The first is latent period or premorbid period. Second is prodromal period. Third is period of the complete manifestation of diseases, and the fourth period is outcome of diseases. There are a number of diseases. For example, in mechanical trauma, it's impossible to separate these stages from each other. But during the other diseases, for example, acute infection diseases, this separation is observed very clearly. The first stage, hidden or latent period of diseases, the period from the moment of the pathogenic factor acts on the body until the first sign of the disease appear, is called latent period of diseases. This stage in infection diseases is called the incubation period, and in allergic diseases, this stage called the sensibilization period. The duration of the latent period of disease is different in different types of diseases. For example, the incubation period in influenza lasts from several hours to days. In measles, it's about 10-11 days. Parotitis, 15-20 days. For example, in leprosy, it lasts several years. The second is prodromal period. This is a period from the appearance of the first sign of diseases before development of typical clinical picture of disease. In prodromal period, general, non-specific symptoms of diseases are manifested. For example, headache, general weakness, fever, and etc. The sometimes specific signs of diseases can occur in prodromal period. For example, in measles, the appearance of the characteristic phyllocoplic spots on the mucous membrane of the inner surface of the cheek occurs in prodromal period of diseases. The third is period of the marked manifestations of diseases. During this period, local and general signs that are characteristic of the particular diseases appear and arise as a result of weakening of the protective and adaptive reactions of the body. And the last period is the outcome of disease. The outcome of disease are the recovery, it may be complete and incomplete, relapse, transition into a chronic form, death. Recovery is a process of restoration of impaired functions of the body. There are complete and incomplete recovery. In complete recovery, there are no traces of disorder observed, and the person's ability to work is completely restored. In incomplete recovery of the disorders observed during illness can remain in the varying degree of the severity. Unlike complete recovery, in incomplete recovery, disability is not fully restored. A relapse is a re-manifestation of disease in the same individual after an apparent complete recovery, which occurs as a result of the fact that the pathogenic factor is not completely eliminated from the organism. Decreased body resistance, weakening of the adaptation mechanism to the action of the number of the pathologic factors can cause relapses. For diseases such as dysentery, peptic ulcer, gout, schizophrenia, chronic pancreatitis, chronic bronchitis, or the number of diseases, the relapsing course is characteristic. The period of the temporary improvement of the patient's states, periods of the relative health between relapses, is called remission. The pathological process, condition, or reaction associated with the pathogenesis of the underlying diseases or manifesting as an unexpected result of the medical intervention for a diagnostic or therapeutic purpose is called complications. For example, perforation of the stomach during ulcer diseases, hypertensive crisis, and etc. The transition into the chronic form is an alternation of the periods of the relief in the patient's state, remission, with periods of the exacerbation. As a result of the incomplete elimination of the etiologic factor, acute diseases can become chronic. And sometimes diseases can initially have the chronic form, for example, in tuberculosis, leprosy. The transition of disease into a chronic form depends on the properties of the pathological factors, the virulence of the pathogen, the duration of its persistence in the organism, in the body, and on the other hand, the reactivity of the body, for example, aging, immunodeficiency states, and etc. This is a logical conclusion of the life of any organism. It may be physiological death and pathological death. Physiological death occurs as a result of the gradual decrease and extinction of the body functions in a process of aging. And pathological death can occur at any age or as a result of violence or diseases. In addition, sudden death can occur. Sudden death can occur as a result of rupture of the aortic aneurysm, for example, in myocardial infarction. The part of pathophysiology which studies the mechanisms of recovery is called cyanogenesis. Cyanogenesis is a complex of the adaptive reactions aimed to maintain homeostasis and restore impaired homeostasis. The mechanisms of recovery are activated from the moment of the influence of pathogenic factor on the body begins. And cyanogenetic mechanisms develop together with pathogenetic mechanisms. The completion of the diseases by recovery is associated precisely with the domination of the cyanogenetic mechanism over the pathogenetic mechanisms. Thus, recovery cannot be evaluated as a reserved development of diseases. Recovery is a new quality process in which the state of the body after recovery differs from the state of the organism before the diseases. And there are three types of the cyanogenetic mechanisms distinguished. The first is the emergency, urgent, unstable mechanism or immediate mechanisms. This includes protective reflexes, for example, sneezing, coughing, vomiting, lacrimation, salivation. These mechanism, protective reflex, which are the protective compensatory reactions that turn on immediately in the first seconds and minutes after the influence of the pathogenic factor on the body. And with the help of such reflexes, the body is cleansed from the harmful factors. The second is a relatively stable mechanism. They last for days, weeks, and this includes the transition of the regulatory systems to a higher level. For example, the change in thermoregulation during fever reaction, the increase the number of the erythrocytes during the hypoxia, the increasing of the number of the white blood leukocytes in infection diseases, neutralizing of the poisons, and etc. And the third is stable mechanisms. The condition formed as a result of these mechanisms persists for a long time, for example, months, years. For example, regeneration, the hypertrophy of tissue, or immunity, the antibody synthesis, maybe as an example for the stable mechanisms of the cyanogenesis. The borderline state of organism between life and death is called terminal state. The terminal state is a state of organism between life and death, and it's a fading of the organism functions before the death. And the stages of the terminal states are pre-agonal state, terminal pause, agony, and clinical death. In the pre-agonal state, the patient consciousness does not completely disappear. The retardation and confusion is observed. Inhibition occurs in the cerebral cortex. Blood pressure sharply drops till to 80, 60 millimeter high, the mercury and less. Bradycardia, bradypnea, cyanosis, loss of pulse in the peripheral arteries are observed. The duration of the pre-agonal state varies from several minutes to several hours, sometimes days. For example, in acute disorders of the coronary circulation, pre-agonal state lasts a short time, and in the blood loss, bleeding, acute bleeding for several hours. In the stage of terminal pause, due to increase in inhibition of the cerebral cortex, the patient lost consciousness, and the increase in inhibitory effect of subcortical centers, respiratory arrest occurs. The pulse is reduced, sometimes disappears, asystole observed. Corneal reflex and the pupil's reaction to the light disappear. This stage lasts from a few seconds to 3–4 minutes. For the agonal stage, the loss of the consciousness and bulbar activity is characteristic. So the bulbar centers in the agonal stage, which are inhibited during the terminal pause, are again activated. At this stage, the respiratory movements gradually recover and become pathological. Prolonged acts of the inspiration are replaced by short-term acts of the expiration, while the duration of the inspiration is several times more than the duration of the expiration. This is due to the release of the centers of the pons, the pneumotaxis and apneistic centers, from the inhibitory effects of the cerebral cortex. That form of breathing is called the apneistic breathing. After this, the nature of the breathing changes again. Single, deep breaths are observed, then the respiratory movements become even less frequent and weaken, and finally completely stop. This due to a complete violation of the functions of the respiratory center in the medulla oblongata. This form of the pathological breathing is called gasping breathing. During the agony, muscles are involved in the act of breathing, which usually don't take part in the respiratory movements. The muscles of face, muscles of neck. The last breath resembles an act of the slowing of the air. A dying organism, as if swallows the air. During agonal breathing, alveolar ventilation is reduced to 20%. Corresponding changes also occur in blood circulation at this stage. Heart, the contraction weakens, blood pressure drops less than 30–40 millimeter mercury. But these changes appear briefly. Cardiac activity weakens even more and finally completely stops. During clinical death, respiration and blood circulation stop, reflex disappear, the metabolic processes proceed at a very low speed, and the body is not yet completely dying. The duration of clinical death is measured from the moment of the supply of oxygen to the brain ceases until the onset of irreversible morphological change in the cells of cerebral cortex. The number of factors affects the duration of the clinical death. Age, for example, in elderly more briefly, the irreversible change in the cerebral cortex occur faster. The temperature, at a higher temperature more briefly, and type of living of the organism, for example, in animals compared to the humans, happens relatively longer, up to 12–15 minutes. And for a person, the duration of clinical death is 4-6 minutes. If during this time oxygen is restored to the cells of the cerebral cortex, it's possible to survive. After clinical death, biological death occurs, and which is characterized by the occurrence of the irreversible change in the cerebral cortex. Reanimation or resuscitation studies the laws of extinction of the basic vital functions of the body and the possibility of their restoration. The significance of resuscitation measures or reanimation measures is to provide organisms and tissues with arterial blood by restoring blood circulation and respiration until irreversible changes occur in the cerebral cortex. One of the main tasks of the reanimation is to increase the duration of the clinical death. For this, the use of the cardiopulmonary bypass, cardiac massage, and the breathing, artificial ventilation of lungs, is of a great importance, as well as ensuring the reduction the body's oxygen demand through the use of the set of measures aimed at slowing down the metabolism by, for example, by creating artificial hypothermia or using of medication drugs to the state of the hibernation. In the effectiveness of the reanimation, the time factor is crucial. So, reanimation must be started as soon as possible. And prior to providing specialized medical care, victims should be given first aid by mouth-to-mouth or by mouth-to-nose breathing or indirect heart massage. And the effectiveness of the reanimation, the following are indicators of the effective reanimation. The first is appearance of the pus on the carotid artery. The second, the decrease of the intensity of the cyanosis. Then the narrowing of the dilated pupils. And at last, the increasing of the blood pressure up to 60-70 millimeter mercury. All they show us the effectiveness of the reanimation. Etiology is a teaching about the cause and conditions of diseases. General and specific etiology are distinguished. General etiology studies the origin and general patterns of the pathological processes and diseases. And specific etiology studies the cause of conditions of one concrete disease. The main etiological factor is a factor the absence of which cannot lead to the development of diseases under any circumstance. The pathogenic cause is a factor that directly causes diseases and gives the disease specificity. For example, the cause of the radiation sickness is ionizing radiation. The cause of infection disease is pathogenic microorganisms. For example, the etiological factor of the tuberculosis is Mycobacterium of tuberculosis, and etc. Etiological factors of diseases divided in two groups: external and internal, or exogenous means external, and the endogenous means internal factors. Exogenous factors include physical, chemical, biological, psychical, and social. Physical factors are, for example, the cold, heat, the ionizing radiation, or the change in the atmospheric pressure, and others. The chemical factors, it's drugs, alkaline acids, some poisons. Biological factors include the influence of the microorganisms, bacteria, viruses, fungi, parasites. And at last, the psychical and social factors mean stress, the negative emotions, which influence in the cerebral cortex, central nervous system. And there are endogenous, internal factors, which take place in the cause diseases. This include age, sex, or organism, and hereditary factors. As endogenous factors, which cause there are the etiological factors of diseases. The interaction between the cause of disease and the body occurs under certain conditions. Conditions for the occurrence of disease are combination of the factors that can contribute to, impede, or modify the effect of the etiological factor. Unlike the etiological factors, separately taken factors of the condition are not absolutely necessary for the occurrence of the diseases. In turn, unlike the factors of conditions, the etiological factor gives rise to the diseases. The only one, its presence is necessary for the onset of diseases. It gives the disease specificity. And there are many conditions for the onset of diseases. Their presence in the onset of the disease is not necessary. They don't impart specificity to the diseases. Pathogenesis, general pathogenesis, is a study about mechanisms of development, cause, and outcome of diseases. Pathogenesis of diseases is a mechanism of the development of diseases which includes the complex of adaptive and damaging reactions. Pathogenesis combines two opposite processes you see here, damaging reactions and protective adaptive compensatory reactions of the body, aimed to restoration of homeostasis. Thus, pathogenesis is a dynamic unity of the damaging pathogenic and restorative cytogenetic mechanisms. In other words, pathogenesis of diseases is a struggle between damaging reactions caused by pathogenic factor and defense adaptive compensatory reactions of organisms. There are several important tasks or the main concepts of pathogenesis. The first is the relationship between etiology and pathogenesis. The importance of the site of penetration of the pathogenic factor into the body and the ways of spreading of the pathogenic factor in the body. Then the causative effect, the relationship. Then specific and non-specific mechanisms of the pathogenesis, local and general manifestations of diseases, the level of damage in the pathogenesis of diseases, and then the structural or morphological and functional change in the pathogenesis, and at last adaptation and compensation reactions in the pathogenesis of diseases. And I will describe in brief about all of them. The first is the relationship between the etiology and pathogenesis of diseases. The development and course of diseases is closely related to the etiological factor. Etiological factors not only cause the disease, but also determine its clinical picture. There are following forms of the relationship between etiology and pathogenesis. The first, etiological factors acting throughout the illness. For example, in infection diseases, the pathogen agent, infection microorganism, persists during all period of diseases. The second is etiological factors that exert their influence only in the initial stage of diseases. The etiological factor trigger pathogenic mechanism at the onset of diseases. For the further development of diseases, the presence of etiological factor in the body doesn't matter here. These factors include, for example, during mechanical trauma, high action of the high-low temperature, ionizing radiation. Here, etiological factor influence only in the beginning of diseases. The third form is persistence of the etiological factor. The factor causing the disease persists in the body after the cessation of the pathogenic mechanism. Moreover, as a result of the interaction of the body and the etiological factors, the latter can change its properties. For example, bacillus carriage after the infection diseases. The second problem is significance of the site of penetration and the pathway of the spread of the pathogenic factor in the body. The etiological factor, in particular, the site of penetration of the pathogenic microorganism into the body, it is called the gate of infection, often determines the pathogenesis and clinical form of diseases. For example, the penetration of the infection through the skin, mucous membranes of the eyes, the nasopharynx, respiratory tract, and gastrointestinal tract cause different clinical forms of these diseases, infection diseases. And the third, the pathogenic factor can spread in the body by three ways. The first is humoral pathway. The pathogenic factors spread in the body through blood and lymph. The causative agent of infection diseases, bacterial toxins, poisons, malignant cells spread by this way. The second is tissue way, or the contact by the spreading by contact way. This way, the pathogenic factor from the area of damage extend to the healthy area, from the one organ to the neighboring organ of the same or another organ and system. An example is the spread of the herpes virus on the skin along the sexual urinary tract, the spread of malignant tumors from the lower to the upper lip, and etc. And the third way is the nerve pathway or neuronal way. Some pathogenic factors, for example, virus of the rabies, tetanus toxins, they spread along the nerve fibers. The next task of the pathogenesis of disease is to determine the causative consecutive relationship and the main link in the pathogenesis of diseases. Throughout the disease, various pathological processes are in the causative consecutive relationship, causative effect relationship with each other. It means the same process can be cause of one and the consequence of the another event. And the main link in the pathogenesis of diseases, the change that causes subsequent disturbance in the pathogenesis is called the main link. The main link arises under the influence of a etiological factor and determines the specificity of the diseases. The elimination of the main link leads to the elimination of the pathological process, and this principle forms the basis of the pathogenetic treatment. For example, the main link in the pathogenesis of diabetes is insulin deficiency. The main link in the pathogenesis of arterial hyperemia is the expansion of the arterioles. The main link in the pathogenesis of the peptic ulcer is the imbalance between the damaging reactions and protective reactions. And you see in this slide there are the several types of the causative consecutive relationship. It may develop in the straight line, the branched types, and vicious circle. We will explain all of them in the next slide. Straight line in the pathogenesis of diseases. If one event is a result of the previous and the cause of the subsequent, this shows the development of pathogenetic mechanisms in a straight line. For example, increasing, you see here in this slide, increasing of the low-density lipoproteins. These cause atherosclerosis, and this in turn leads to the coronary insufficiency. They result in myocardial infarction. Myocardial infarction will result in the cardiogenic shock, and this causes the death. Or another example, for example, narrowing of the left atrioventricular orifice lead to the expansion of the left atrium. This leads to the left ventricular dysfunction. This causes the stagnation, congestion of the blood in the right ventricle, which causes respiratory failure, pulmonary edema, which lead to the hypoxemia, and it was hypoxia. All this show us the straight line in the development of the pathogenesis of diseases. You see here branched type, and this type includes divergence and convergence. In divergence, the same pathogenetic event leads to the several consequences. For example, you see here insulin deficiency in diabetes mellitus as a central link, main link in the pathogenesis, lead to the disruption of the carbohydrate metabolism, lipid, protein, water salt metabolism, and etc. And in the next slide is convergence. Another version of the branched type is convergence. In convergence, various pathogenetic mechanisms lead to the same effect. For example, various biologically active substances, histamine, serotonin, prostaglandins, formed during inflammation, all they lead to the same effect, the expansion of the arterioles, and arterial hyperemia occur. And formation of the vicious circles in the pathogenesis of diseases. The disturbances caused by certain mechanisms of pathogenesis after a series of sequential processes lead to an even greater deepening of these disorders. The development of diseases as a vicious circle is most dangerous because in this case the pathogenesis of diseases supports itself and worsens the course of diseases. The example of the formation of the first vicious circles given in the pathogenesis shock here. Remember please, all types of shock accompanied by severe sharply decreasing of the arterial pressure. Decreasing of arterial pressure leads to the hypoxia in all tissues of organism, and this leads to the even weakening of the activity of vasomotor centers in the brain, which in turn lead to the the decreasing of arterial pressure, and this circle repeated and repeated. Another example for formation of the vicious circle, for example, in the increasing of body temperature is a stage of decompensation in hyperthermia. As a result of hyperthermia, the overheating, an increase in body temperature leads to the acceleration of the all biochemical reaction, and including oxidation reactions. This leads to an increase in the heat production and even greater increase in the body temperature. And by this way, the vicious circle formed in the pathogenesis of diseases. And at last, the adaptation and compensation, the last task of the pathogenesis. Adaptation is the ability of the healthy organism to adapt to the constantly changing environmental conditions. Adaptation mechanisms formed in the evolution, and adaptation mechanisms are aimed at maintaining the constancy of the homeostasis and prevent damage of the body under the influence of environmental factors. For example, in the condition of the highlands in the mountain, the increase in the number of red blood cells per unit volume of the blood can be estimated as an adaptation mechanism. The compensation is a reaction aimed at restoring homeostasis impaired due to the action of the pathogenic agent. Compensatory reactions are aimed at eliminating of the result of the damage. This mechanism also formed in the evolution. The basis of these reactions, adaptation and compensation reactions, are the same mechanisms, and differences between these concepts is the adaptive mechanisms are activated when intensity of the influence of ordinary environmental factors increase. In this case, there is no damage in the body. And compensatory reactions are included if, under the influence of pathogenic factors, the indicators of the homeostasis deviate from the norm. In other words, compensatory reactions develop if there is a damage in the body. Adaptation and compensation mechanism can be manifested by both functional and structural change. And these mechanisms divided in two stages. You see here, immediate reactions and the long-term reactions. Immediate reactions, reserve mechanisms of the body mobilized during here. As a result of this, the work per each unit of the system or tissue increase and hyperfunction occur. An example is an increase of the function of the remaining intact nephrons during necrosis of the part of the kidney nephrons. And long-term reactions is accompanied by increasing the number of structural elements in the organ or tissue. Such compensatory mechanisms include hypertrophy, hyperplasia, regeneration, or formation of the collaterals. Principles of treatment. At the beginning of lecture, we said that one of the tasks of the pathophysiology and general nosology is to study the general principles of treatment. And you see here the etiological, pathogenetic, and symptomatic the treatments, types of treatment are distinguished. A set of measures aimed at eliminating of the pathogenic cause is called etiological treatment. Such treatment can be carried out both medically, and surgically. If the medically, for example, the using of the antibiotics against causative agent in the infection diseases, and if surgically, for example, the surgical the operation by surgical removing of the tumor from the organism. The next is pathogenetic treatment. It affects the mechanisms of the development of diseases and is aimed at straightening of the compensatory reaction and to block the damaging mechanisms. For example, in allergic reactions, the pathogenic treatment can be carried out acting on several mechanisms of the allergy. By using of the glucocorticoids, the synthesis of antibody can be reduced, and specific desensitization can be eliminated antibodies from the body, from the organism, and using of the synthetic antihistaminic preparations. They can block the histamine receptors on the cells. And sometimes histological and pathogenetic treatment are ineffective. In this case, symptomatic treatment is necessary. For example, the use of analgesics in cancer patients in the final stage, so here they can reduce their severe pain. And finally, I hope I can describe you the main points in the structure of the pathophysiology, and thank you for listening.